We can continue the discussion now with Professor Armin Alaedini from Columbia University Medical Center, another prestigious medical institution in the United States where so many of these cases have been reported. Thank you for taking the time.
Thanks for having me.
Do you think people are taking Lyme disease seriously enough or too seriously? Or what's your general view of this condition, which has increased steadily over the past 25 years without a vaccine being developed, despite several vaccine options for pets, for example, like dogs?
Well, there is certainly a lot more attention given the infection, and so there is a lot more awareness of the disease that has contributed to, in some cases, perhaps an overdiagnosis of what some might call Lyme disease. But still, it should be mentioned that, and perhaps your other guest said this already, that it is the most common vector-borne infectious disease in the U.S. and Europe, and probably in Asia as well, including South Korea. We have about 300,000 cases of Lyme disease, at least in the U.S., and it's been increasing dramatically in the past several decades. So it is a very serious disease. It is to be taken seriously, and there are some shortcomings, as perhaps your other guest alluded to, regarding diagnostics.
We've got a message from 0198. I'm curious if you'd be exposed to it in the winter time. I guess in America, the winter conditions would vary considerably from California to Texas to New York, or wherever you happen to be. Winter would be a different experience. But what's the general answer on that, though?
The general answer is no. The time that one is most likely to get Lyme disease is in the summer, late spring and summer.
Among the illnesses, though, caused by ticks, we've actually got potentially much worse conditions here in Korea, fatal illnesses. For example, every summer here we get reports of at least a handful of cases of SFTS, severe fever and thrombocytopenia syndrome. So in the sort of range of problems ticks can cause, where is Lyme disease?
Well, Lyme disease, as I mentioned, is the most common tick-borne illness. There are other ones, as you mentioned, anaplasmosis, babesiosis, other ones as well. And ticks can be carriers of multiple infectious agents. In terms of severity, Lyme disease itself can vary a lot in terms of severity and the type of symptoms that the patients experience, all the way from the early stage where you have the skin manifestations and flu-like symptoms, all the way to the later stages where the patients can have joint manifestations, even severe neurologic symptoms.
So as we've been hearing, there are potential complications from what you've just mentioned there to arthritis and even heart arrhythmias, for example. But when Justin Bieber, who's been drawing attention to this and is really the reason we're talking about it this morning, wrote on Instagram that he was getting treatment for what is so far an incurable disease, according to his statement, is that a fair description?
Well, I think it's important to mention what exactly Lyme disease causes. So it first of all, it's caused by, as your listeners know, by bacteria called Borrelia burgdorferi. The bacteria pass on to humans through the bite of ticks. The disease has multiple stages, ranging from, as I mentioned, the skin all the way to neurologic, etc. The majority of patients with Lyme disease respond well to antibiotic treatment. It's important for listeners to know that, which is usually oral doxycycline in the early stage and intravenous ceftriaxone in the later stages of infection. But there are patients who go on to have more persistent symptoms that are more difficult to cure. That is the minority of cases, though patients should know.
Is it?
In other words, it
Yeah.
is curable in the majority of cases.
Is it necessary to distinguish between what some people call chronic Lyme disease, i.e. symptoms continuing, and what might be described as post-treatment Lyme disease?
It's a very good question. I think yes. Active infection is something that can be treated with antibiotics. Patients may develop, a minority of patients with Lyme arthritis develop what's called refractory Lyme arthritis. That is not believed to be a persistence of the infection itself, but immune-mediated mechanisms being involved there. Those patients respond to anti-inflammatory agents. These are patients who have continuation of swelling and pain, etc. And then you have these patients who we call in the scientific community, we refer to the condition as post-treatment Lyme disease syndrome, where they have symptoms months to years of pain and fatigue and cognitive difficulties. That's what we call post-treatment Lyme disease syndrome. Now, some people refer to this as chronic Lyme. Now, there is chronic Lyme is sort of a generic term that some people also use to refer to all kinds of symptoms that may or may not be directly related to Lyme disease. So chronic Lyme is basically a much larger pot of symptoms that people use for basically symptoms that we don't have a way to determine whether they're related to Lyme disease.
Well, thank you as well, Professor Armin Alaedini from Columbia University Medical Center. Good to have you with us on the line.